Thank you all for joining us for Regain Your Brain. This presentation went over really well last time, and we had a number of folks that weren't able to attend, so we wanted to go ahead and offer this one more time. And as always, we want to remind everyone that we don't diagnose, treat, prevent, or cure any disease, and our information is for educational purposes only, not intended to be a substitute for sound medical advice. And I'm Carl Malone, and I'm a board-certified doctor of natural medicine. I also hold a bioenergetic medicine doctoral degree, and I'm a registered psychotherapist. I'm certified in neuro-emotional technique, which is a very effective tool to help us along our healing journey. And I've been a licensed massage therapist teaching laser neuromuscular therapy since 2002. So I have a lot of experience working with injuries. I owned a clinic where I treated car accident cases and had a staff of 10. So I want to introduce Kimberly. And Kimberly, if you'd like to go ahead and tell us about yourself.
Okay, I'm going to try to without the dog interrupting me. My name's Kimberly Malone, and I'm certified as a functional diagnostic nutrition practitioner. Really what that discipline is a very step-by-step logical procedure of looking at the body through lab work and determining if there are any hidden stressors or other underlying conditions that may be causing symptoms. And we don't actually treat symptoms, but by working on the body as a whole, we often see symptoms disappear. So that is my background.
And it's a great complement to what we do here at the Natural Path, where we use a lot of muscle response testing, but sometimes we need to dig a little deeper, and functional diagnostic nutrition gives us data, lots of data, which really can help us to help sort through what's really going on with someone. Talking about the brain represents 2% of the body's total weight. It requires a quarter of the oxygen and glucose, the energy that we consume, just to keep going. It uses 20% of the body's electrical energy. The hourly blood flow of the brain is approximately 13 gallons, which accounts for 1/5 of the blood that is pumped by the heart. And the brain is composed of 30% protein and 70% fat. So we'll be talking about why it's important to consume healthy, good fats. So I think we all know or have known someone with Parkinson's, schizophrenia, Alzheimer, dementia, or maybe even we're seeing some signs of some fading with our memory or cognition. We may even be seeing headaches and migraines, blurred vision, dizziness. Sometimes we're having balance and coordination issues, or poor night vision are good indicators that maybe the brain's got some areas that we could support. A lot of things can cause a brain condition, like a head injury or a fall or a concussion or a car accident, getting a hard whiplash. Traumatic birth, even using forceps at birth, can result in some head trauma that may not show up for years. And toxicity in the form of chemicals and dental and environmental toxicities can build up. There are household toxins, industrial toxins, all the chemicals used in pesticides and fertilizers, car exhausts. These things can contribute to toxicity. So head trauma can lead to difficulty concentrating. It can lead to memory problems and brain fog. It can even lead to irritability or personality changes. We can find ourselves having sensitivities to light or noises. We can have disturbed sleep. It can result in depression and psychological problems. And sometimes it shows up in the form of disorders to our sense of taste and smell. So to tune up our brain, there are a number of things that we can do to really help. Supplements can make up the difference between perhaps what we take in the form of food, and then what our body needs to function. Supplements can make up that difference. I like to use a brain tincture. It's a form of extracts combined that work really well, and I'll go into a little more detail here as we go. I also like to use cranial sacral therapy. And cranial work has to do with the rhythm of the movement of the bones of the head. Those bones should articulate together and work as a pumping action to pump the cranial sacral fluid through the cranial cavity and the tube that runs down the spine called the dura. And that rhythm, actually the brain and the rhythm of that movement should expand and contract 6 to 10 times per minute in the average person. If we've had a head trauma, we may have one side that's moving okay and the other side maybe is off or sluggish or not moving. With cranial, we can get that rhythm reestablished. We can use low-level laser to test and reset the cranial nerves. I'll talk about that a little more as we go. It's also helpful to learn about EMF. A lot of us suffer from EMF, electromagnetic sensitivity. Our cell phones give off electromagnetic frequencies that can disrupt and disturb our heart rhythm and our electrical function in the body. Also, learning to mitigate light, especially at night, even wearing blue blockers before you want to go to sleep. And detoxification is huge. Our body is made to detox, but when it gets overwhelmed, the liver can become sluggish. The systems can get overwhelmed where we're not getting good, clean detox, and we have some great ways to enhance that. Correcting our diet and avoiding things and finding out what things that we might need to avoid is a huge step that we can make, and getting proper rest. Our body should actually change into a form of rest and heal, rest and digest at night. But if our body is blocked or stuck in fight or flight, when we go to bed during our sleep cycle, when we should be resting, our body's still working, which means that we're working maybe 24 hours a day, and that means that our body is burning out, wearing out, and we're aging faster than we should be. So getting proper rest and learning more about rest is important. We'll talk a little more about it. And getting some exercise, getting blood flowing, getting oxygen, that's also a big part of the detox and the detox function. And learning how to recognize and reduce stress. These are great ways to help improve our brain function. A few years ago, there was a movie that came out based on the concussion condition that was identified with pro football players. Royal Lee identified this condition years ago, and he surmised that when we have brain trauma, some of those brain cells, those protein cells, get dislodged and make their way into the blood system. Then the antibodies that are searching in our bloodstream, what happens is our body detects proteins that don't belong in the blood. And there are macrophages in the blood that are searching for those intruders, and they can literally gobble them up, and they essentially spit them out on the outside of their surface and float around like a wanted poster, telling the white blood cells, if you see these guys, take them out, kill them. Then what happens is those antibodies find those tissue in the brain, and the system gets confused and it begins to start attacking itself. This can happen with any tissue that's damaged. In the form of a heart attack, we can find those proteins in the blood. Those proteins show up in the bloodstream, and the immune system gets confused and begins to attack itself. So the movie Concussion, with the character Will Smith played, Dr. Bennett Imalu, he was an MD that actually spent his own money to have brain sections dissected and was able to identify this condition, and he actually named it and was credited with naming it chronic traumatic encephaly. And Dr. Lee had identified protocols where we can use similar proteins that will distract the immune system and let the body restore those tissue, let the brain get restored and let it receive and get the nutrients and the support it needs to naturally repair and restore, because our body's made to naturally do that. In addition, we can use the cranial nerve upregulation that I do with laser, and we can use cranial sacral therapy, and we can use specific protocols through nutrition to help restore balance and restore those tissues, and even use the laser to help restore coordination and vertigo and balance issues that we may have. So CTE, as I just alluded to, results from chronic traumatic hits to the brain. And it can happen in pro athletes, but it can also happen with somebody that receives a number of head traumas. So the National Football League commissioned a report that started looking at these football players that started having severe headaches, drastic personality changes. Some of them even committed suicide. And so this is how this CTE came about and was discovered. And it also resulted in new rules on not allowing head-to-head contact in football, and new helmet rules, and increased better manufactured helmets for players. So we use, in standard process, PMGs. They're called protomorphogens. And these are cells that can help distract the immune system. Much like a plane flying along and, say, a terrorist launches a missile at that plane, the plane is equipped with countermeasures, like flares in this illustration. So the plane would then detect the missile coming, shoot out a bunch of flares, and as the missile is distracted and goes after one of those flares, the plane flies off and stays safe. And in this sense, that's how a good example of how protomorphogens work, to help us restore those tissues. Not just in brain, but we have protomorphogens for other tissues in the body as well. Then we might use an extract to actually feed the brain or feed the nerves. Neuroplex, the X represents extract. And so that we have the extract to help support the hypothalamus, the pineal, the nervous system. It can help support our cognitive function. It contains a broad spectrum of vitamins, minerals, and complementary tissues to support the gland function and help restore that function. With standard process, we also use Cataplex G, and it can help restore that parasympathetic balance, that rest and heal, rest and digest. So that can help support the brain and the brain's restoration, and it can help support the body's metabolism. We also use RNA, and I really like RNA. It's something that I will probably take as part of my protocol long term. It helps support cell reproduction. It helps with protein synthesis. It just helps with cellular growth and developing healthy new cells. We also use a product called Oprima DHA, and that provides a very high concentration of omega-3s and DHA. It supports healthy triglycerides and healthy HDL levels. So healthy CDL levels, HDL levels. So we always hear about cholesterol, and there's healthy cholesterol and unhealthy cholesterol, and there are ways to help the body remove unhealthy cholesterol. It also supports a healthy inflammation process, and it supports the cardiovascular function, and it supports the brain and brain health and cognition. One product that I really like, and I will always probably keep it as part of my supplement routine, is OPC Synergy, that helps support normal healthy cell function, and it can help with cognition and brain function. and it supports proper aging, helps us with healthy aging, and it supports our cardiovascular system. It helps with our capillaries, capillary integrity. It restores collagen and helps it keep it strong and elastic. It also is very beneficial in neurodegeneration. So it helps also with psychiatric disorders. And it includes a combination of grapeseed extract, buckwheat, red wine extract, green tea extract, and bilberry. And it can actually cross the blood-brain barrier to help restore those tissues. So the Regain Your Brain protocol, I like to have you come in and let me just test to see, or we can do an online session nowadays. We do an awful lot of those. But we can have a 6-week protocol that might include a combination of the PMG neurotrophin. It might include the extract of Neuroplex, the nerve extract, combination of gRNA, Olprima, and we might even use Cataplex ACP and or OPC synergy. And this combination, if you do a 6-week protocol, we ask that you do a 6 weeks so that you can actually experience the results and we can measure how well this is working for you. And we'll offer a 20% discount through the end of the month of June for this protocol. So this protocol might include brain juice, and this is one that Kimberly affectionately calls brain juice. It's a brain tonic that consists of 3 extracts. I learned this from a mentor who had fantastic results, and I too have had tremendous results. It uses a medi-herb called Bacopa, and one called Ginkgo, and one called Gotu Kola liquid. And Bacopa supports normal memory function, it supports brain function, and what I've discovered is it promotes mental clarity, concentration, and focus. And ginkgo is well known. Ginkgo is one of the oldest herbs studied in Chinese medicine that also helps with memory and mental clarity. It helps with the eyes and vision. It supports hearing. It supports the body's aging process. It helps maintain energy levels. It supports our cardiovascular system. It supports healthy blood. And it supports the oxygen flow to the brain and the peripheral nerve or peripheral capillaries in the rest of the body and the extremities. Also, Gotu Kola. Gotu Kola extract promotes healthy tissue function. It helps support the body's natural tissue repair process. And it can help the body as it has to adjust to stress. It supports the body's physical and mental endurance. And it tones the veins and promotes healthy vascular function. And it helps maintain vascular integrity, meaning those capillary walls. If you've ever seen broken or you have broken blood vessels in the face or in the legs, or you have pink toothbrush, those indicate that there is perhaps some need for support for those cell walls. They can become fragile and brittle, and we have some specific things to help keep those capillaries flexible so they can expand and contract as our blood pressure changes. So what else can we do to support the brain and brain function? Here at the office, we have biofeedback, which I've been doing biofeedback for over a decade. And it works tremendously well with scanning the body to see what things are stressing us, and then to help use homeopathic remedy frequencies to balance the body to those stressors. And we have over 100,000 frequencies that we scan the body for to see where things are throwing us off. And that could include pollens or trees or weeds or foods. We usually start with foods because that's the thing that affects people the most, or that they may notice the most. But we have environmental toxins and household toxins and pesticides and metals and chemicals and things in our environment that could be throwing us off, robbing us of our energy. And EMF mitigation, learning to maybe shut off our Wi-Fi at night, learning to detox. Here in the office, Kimberly's focus has to do with a process called DRESS, a protocol that involves looking at diet, rest, exercise, stress reduction, and supplementation. So as I mentioned, our biofeedback scan can scan the body for over 100,000 frequencies that could be throwing your body off and could be resulting in what shows up to appear as allergies to the body. But rather than taking an over-the-counter remedy, we use the homeopathic remedy frequencies and administer those to specific points around the body that are old 4,000-year-old acupuncture points to help balance the body to those frequencies. Cat hair, for example, we can't change the frequency of cat hair, but perhaps we can change the way the body reacts to cat hair. And that's a basic premise for biofeedback. And craniosacral works with that rhythm of the movement of the bones of the skull that should expand and contract 6 to 10 times per minute. I like to use low-level laser therapy in conjunction with craniosacral therapy. I found that those sutures that separate each of the structures of the brain or the skull really tend to release and let go and move much better when I incorporate low-level laser with them. The cranial nerve reset lets me check every one of the 12 major cranial nerves and test to see whether they may be, say, shut down or not working as fully as they could. The laser will help to upregulate those functions. Wi-Fi mitigation, turning off your Wi-Fi at night, not having your cell phone next to your head or under your pillow is tremendous. Those cell phones ping every 16th of a second. So you're taking thousands of hits every hour. And so if you've got 2 cell phones or you're riding in a car with 4 people with their cell phones, your body is taking an awful lot of EMF hits. And a child, their brain density is much less than an adult. So the children spending a lot of time on the cell phone are getting an awful lot of EMF into the brain and into the nervous system. Detox is huge, and we have great ways to help remove harmful waste and metals and chemicals that can be affecting our brain and our cognition and even our balance, coordination, our function, our emotions, our personality. These can all be disrupted through being toxic. Foot baths, foot soaks are great ways to help detox. So there's some great options that maybe we're not aware of. For example, the way your body naturally detoxes, 70% is through the lungs and through breath. If you were to spread out all the alveoli, tiny little sacs in the lungs that transport oxygen into the blood, that's the size of a tennis court. So that's a giant fan that's helping us to extract toxicity. 20% of our detox comes out through the skin. That leaves 10%. 7 is urine and 3% is bowel. That's the way your body naturally eliminates. So if it can't eliminate through any of those mechanisms, sometimes we'll have stuff that comes out through the skin. That's one example of your body showing that it may have some toxicity, and we have ways to help support your body's natural ability to detox. So we use nutritional kinesiology, muscle response testing, to find out what is the priority and what does your body need to get rid of that particular toxin. Diet. That's so important to take a look at our body's reaction to sugar, to wheat and gluten, to perhaps dairy and processed foods. All of these things that could be preventing your body from working in its natural healing mechanisms, and learning to avoid those foods that cause us to have reactions. And even here in the office, Kimberly has a test that allows us to do a food sensitivity test, a blood test, to help find out what is your body's reaction to specific foods and food groups. Getting proper rest. If your body's working all night, it thinks it's still jogging along or trying to run a marathon. Your body isn't dropping into rest and heal, rest and digest. We have a computer test, a heart rate variability that lets us see, is your check your body's ability to go into rest and heal, rest and digest. Is it able to adapt to stress and recover? And then a lot of people don't know, but for every hour of sleep you get before midnight, that is the equivalent of an hour and a half worth of rest and healing, rest and restore to your body. Getting good exercise. This is going to get that blood flowing to the brain. But every organ has its own movement. And getting that movement going to help those functions, those basic metabolic functions of each organ and the brain and the lymphatic system relies on movement to detox. You don't have to go do CrossFit or kickboxing, but the more you do and the more intense the better. But just getting some good movement every day and getting some good sunshine and some good fresh air is going to help your body's natural ability to build the immune system and detox. Managing stress. Stress can really contribute to brain issues. In this day and age, we are under a lot of stress. Learning how to recognize the things that stress you. Perhaps watching the news is stressful for you. Perhaps certain things at work, if you could learn how to cut down the stress load, it's going to help your body rest and heal. We like to use neuro-emotional technique to find the hidden emotional stressors that could be preventing your body from healing, or maybe you feel stuck and you keep repeating patterns in your life. Neuro-emotional technique can help you find and clear those old neuro-emotional complexes that you may not even realize you have. So neuro-emotional technique is one of the most powerful tools in my toolbox to help you get ahead and get unstuck. Getting the proper supplementation is very important. Here at the Natural Path, I believe what we do best is take the guesswork out of nutrition. Because nowadays when somebody has something going on, they ask Dr. Google. And Dr. Google might say you need B12 for that condition. That may be the perfect thing for that condition. But someone goes to the drugstore or to one of the stores to find some B12. And they see all these shelves of B12. And it gets really confusing because you don't know which one you need. And so you might pick the one that has the nicest label or the one that's the least expensive. If it's all synthetic, laboratory made, your body may not be able to use it. There used to be cassette tapes. A lot of younger folks may not remember what cassette tapes are. But they had a brand called Memorex. And there was a commercial that showed a band playing music and a cassette player playing a Memorex tape. And it said, is it real or is it Memorex? Well, your body knows if it's Memorex, and if it's laboratory made, it may discard it. It may not be able to use it. It may even diminish other areas of nutrients in the body. So we recommend whole food, natural, from the earth nutrition because your body knows how to break that down and how to use it effectively. That's the way the body is made, and that's what we like to give the body to restore and heal. So we use muscle testing to help take the guesswork out of nutrition. And I think that's the most important thing we do here at the Natural Path, is taking the guesswork out of nutrition so that you get the right amount. People bring in bags of things that they purchased and they take, and I'll test to see, is it working for them or are they wasting their money? And that's the important thing, is it doing what you're paying it to do? Brain injury has always been something very personal to me. I've worked with a lot of people with head injuries and brain injuries. And I just want to let people know that we have a lot of great tools here for you, and I can do those brain resets, the nerve resets, and I can do the biofeedback, and I can help make recommendations based on what your body shows that it may need. So we would love an opportunity to help you and to work with you. We really appreciate you taking time to watch this video. We ask that you'll please share it with others that might have these kind of questions and concerns. Give us a call. We're always happy to talk with anyone about what's going on with their health, and we would look forward to seeing you and serving you. Thank you. Thank you for attending.